Hello and welcome to your Learn It training for the CariFree screening and treatment system. Before we get started, please take a minute to locate your bright green toolbox containing your training packets and product samples to reference during this video. You should have received a few copies of the book Balance in your toolbox. Feel free to flip through it. It will be a great resource to use as you work through implementation. I also have lots of practices who like to photocopy sections of it for patients to take home so they have more information. You will also notice throughout the presentation I have marked on some of the slides where you can find that section in the book. CAMBRA is an acronym that stands for Caries Management by Risk Assessment. It is a protocol to manage and prevent dental caries. It began in the early 2000s at the UCSF School of Dentistry with Dr. John Featherstone and his team. CAMBRA is supported by the California Dental Association Foundation. If you are listening to this training, I can assume we share a common mission, which is the long-term health of our patients. Our mission as a company is to educate the dental profession on CAMBRA and stop tooth decay. It's that simple. It's important when implementing a new system to ask yourselves what your goals are for the program. I encourage you to take a moment, stop the recording, and discuss why you are implementing the program and what you hope it does for you and your patients. Please locate your green Reference It booklet and grab a pen or pencil. We will be walking through this today, and by the end of this video, you will have a solid starting protocol in place. Your program includes two separate forms to use as your roadmap to take you and your patient from assessment to diagnosis and the recommendation of therapy. These forms can be seen on pages 4 and 5 of your Reference It booklet. The first form we will look at is the Caries Risk Assessment Form, or the CRA form. This form will be used to gather 3 data points, which are risk factors, disease indicators, and biofilm challenge, and those will allow us to identify our patient's level of risk on a scale from low to extreme. Now the patient can be responsible for filling out the top patient use section highlighted in blue on the screen. They will let you know if they would like the screening test done and if they are interested in discussing therapy options. Then the disease indicator and biofilm challenge sections will be completed by you. Once you have gathered all the information in the blue and purple sections, then you move to the green section called the Professional Assessment Summary. Now this is where the rubber meets the road. This is where we translate the information into a diagnosis of risk. With each of the 3 data points, you will want to ask yourself if you are concerned with what you see. So, for risk factors, before you circle yes or no, look up to the risk factor section, see what the patient has said yes to, and ask yourself, are risk factors a concern to me? Based on your level of concern, circle yes or no. Then continue the same process with disease indicators and biofilm challenge. Once you have your 3 answers, you can move the patient into their risk category by simply following the pattern of circles you have made. We'll go through a quick sample patient to give you an idea on how to fill out the CRA form. Under risk factors, let's say our sample patient selected yes to dry mouth and yes that they take multiple daily medications. We'll go ahead and say that yes, those risk factors would be a concern. Next, for disease indicators, let's also say that this patient came in with new decay today, so we will also circle yes, the disease indicators are a concern. And lastly, the biofilm challenge. We'll get into this a little bit later in the training. But for this example, we'll say this patient had a low biofilm challenge score. So we'll say no, the biofilm challenge is not a concern. So then we look into the risk identification section and find the category where the highlighted boxes match yes, yes, no, or they go right, right, left. We can see that category 4 follows this criteria. Yes to risk factors, yes to disease indicators, and no to biofilm challenge. Therefore, we know that our sample patient is category 4 or high risk. As far as logistics go, we need to decide where you want to gather the risk factor information and who you want to screen. So first, where do you want to gather that risk factor information from the patient? You have a few options here. You can either hand this form to the patient and have them fill out the top section in the reception area, or you can go through it with them in the operatory. If you choose to have it filled out in the operatory, are you going to ask the questions interview style or have the patient self-report? Now that you know where and how you will gather the risk factor information, who do you want to screen? You have a couple of options here as well. You can either screen everyone or hand select. Please take a moment to stop the video and record your decisions in your Reference It booklet. Great, so now let's talk about where to go after we've determined our patient's risk category. Our sample patient was diagnosed high risk category 4. So all you need to do is find the corresponding treatment column on your Caries management guide. Each column contains all of the information you will need to complete the process and make a therapy recommendation. You will notice the guide is set up to offer 3 levels of treatment: recommended therapy, provisional therapy, as well as the option to decline. And under decline treatment, you will also notice some percentages listed, which are meant to inform the patient of their likelihood of experiencing new decay within 12 months if no changes are made. The form is set up with the 3 levels of therapy to meet the patient at their level of motivation. We want to be sure they only select the treatment option they can realistically follow through with and don't feel forced into purchasing anything if they aren't ready to begin treatment. When recommending therapy, it's important to think about when that will happen during the appointment. It may not always be the same depending on how you structure your exams. So take a second and think about how your appointments are structured. When do you think it would make the most sense to present treatment to the patient? Feel free to try it different ways and see what works best. You also have a few options on how you present therapy. You can show the patient the laminated guide and offer the 3 options and have them decide, or you can simply tell them what option you want them to do. Great, so that's how we assess and diagnose, and then know what treatment options are best. Now let's talk a little bit about the products you have in office. When understanding this disease and explaining it to patients, the easiest way to look at it is in terms of a balance between risk and protective factors. A patient's level of risk is determined by how their particular combination of these items affects their oral environment. With every single patient you see, whatever is going on in their mouth is a result of this balance between their disease indicators, risk factors, and whatever protective factors they have. And it's our job to find out what protective factors and treatment products each patient needs to outweigh their level of risk and keep their balance in check. So what do we use to tip our patient's balance toward health? Well, what we know is there are 5 treatment components, and you can see them listed here, that are prescribed to manage dental caries. These 5 agents are what we will use to change our patient's balance. The star figure you see is what we call the CTX guide. It provides a standard way for us to quickly assess all anti-caries products based on their contents. Each individual product is given a score based on the number of those 5 components they contain. One of the benefits of the CTX guide is that it makes product comparison conversations with patients very easy. For example, we often get the question, how is CariFree different from the product I'm currently using? And all you need to do is plug whatever product the patient is asking about into the CTX guide and give it a score. So you can see the 3 main products listed here with the appropriate components highlighted for each one. It's also on the packaging of the product, which makes it convenient for you and the patient. So we're going to walk through each, starting with the CTX4 treatment rinse. This is the one that usually comes with the most questions. First, it is named the CTX4 rinse because it contains 4 out of the 5 components, which you can see highlighted on the screen, and again, it's also on the packaging of the product. Now, the main purpose of this particular rinse is the antibacterial component, and it will only be prescribed to patients with a high biofilm challenge. That's type 3 high risk and type 5 high or extreme risk. Now, one of the things to note about this rinse is that the antibacterial agent we are using is sodium hypochlorite, so it's a bleach solution, and in turn it has a pretty unusual taste. I call it unusual because it's not the worst in the world, but it isn't the best either. You'll get a varied response from your patients, and I just recommend that everyone tries it before prescribing it. Be very upfront and honest with them about the taste. Next is the CTX4 Gel 5000. It also has 4 out of the 5 necessary components, which you can see highlighted on the screen. However, the difference is that this does not contain the antibacterial component. Instead, it contains nanohydroxyapatite, a form of calcium and phosphate for remin support. The gel is included in each kit, which we will cover in just a moment, and is used as a toothpaste replacement. And last but not least, the CTX3 rinse. Name that because it contains 3 out of the 5 necessary components, which, again, you can see highlighted on the screen. And the biggest difference from this rinse and the CTX4 rinse is that this one does not contain the antibacterial component. Here you can see the 4 different CTX kits. As far as the kits go, try not to get too hung up on the numbers. Just know the higher the number, the higher the level of therapy the kit contains. Each kit comes with a 3-month supply of products. As far as instructions go, each kit contains an insert with the proper instructions for product use. If you compare, you will notice there are conflicting instructions on the products themselves versus the instructions on the insert, and that's because the products are labeled for individual sale. The instructions on the insert are the most effective and the ones we want patients to follow, not the instructions on the product. So a few protocol decisions we need to make with regard to the product. First, you will want to decide if you are going to charge CariFree's recommended pricing posted on the guide, or if you would like to create your own fees for the product. The fees we have outlined are the average we see practices charging. We also have a guide available without pricing if you decide you would like to set your own fees. Then it is important to decide if you will be dispensing the product in the operatory or if you would like the patient to pick it up at the front on their way out. If patients are getting it from the front, make sure whoever is checking them out feels comfortable enough finishing the process and possibly answering any last-minute questions the patient may have. Great, you guys, we're almost to the end, but last but not least, let's talk about the Caries screen test. Remember, this is one of the 3 things we are looking at to determine our patient's level of risk. It's a vital piece of the puzzle. However, when interpreting your patient's test, it's important that we all take a step back and understand exactly what the meter is and isn't telling us. The common misperception, which is totally natural and happens to every practice we train, is that the meter will always correlate to cavities. So if the patient has a mouthful of decay, they will always get a high reading, and if they don't have decay, they will get a low reading. However, the purpose of the meter is not to confirm decay or tell you if your patient is a good guy or a bad guy, but to diagnose which patients need the CTX4 treatment rinse and which patients can go straight to the CTX3 rinse. I will be completely honest with you, the test itself is actually very easy. The hardest part of the test is just managing your patient's reaction to the reading. One of the scenarios we see play out all the time is a seemingly healthy patient, or even one of you, a dental professional, screen high. Sometimes the patient feels embarrassed, or shocked, or defensive because they think the meter is tattling on them and telling you they haven't been brushing or flossing like they should be, when really this is normal. And it all comes back to the balance and your professional level of concern about each data point. The other scenario we often see is the patient who has decay but gets a low reading. This is also normal. Like we talked about before, it allows you to prescribe the correct treatment. Because this patient doesn't have a bacterial issue, they don't need the antibacterial rinse. So you will notice on the guide they are prescribed the CTX21 or the CTX12 kit. Like I said, the technique of conducting the test is not difficult. It's actually very easy. First thing to do is turn the meter on. Make sure you're doing this test prior to the prophy and probing. You will notice the meter will count down from 60 every time you turn it on. You will know it's ready to take your sample when you see 4 dashes on the screen. And note that it will fall asleep after 5 minutes of not being used, so make sure to check and see if it's on if you're going to be doing multiple tests. Then, with gloved hands, you'll want to pull the swab out of the protective plastic tube. Grip the swab near the cotton tip like a pencil. It's flexible, so you can bend the swab if that's helpful when taking your sample. Then, just swab the lower linguals, number 22 through 27. It is essential to avoid all soft tissue, like the lips, the cheeks, the tongue, or the gingiva. Use one firm swipe. Don't scrub or go back and forth. If patients have a lingual bar, you can wedge the swab between the teeth and the bar to pick up biofilm from both surfaces. And it's okay to swab false surfaces, like partials or dentures, because the biofilm is the same no matter the surface. And if a patient is missing teeth and there is no partial, simply move the protocol back in the mouth, and make sure you're picking up biofilm from 6 teeth total, and stick to that lingual surface. So once you have your sample, place the swab back in the tube, bend the liquid-filled bulb at the top until the little blue plastic breaks. Then squeeze the liquid out, like an eyedropper, and shake vigorously for 10 seconds. You want to make sure the swab tip is totally saturated with the liquid. Then, place the entire swab, still in the plastic tube, in the meter. Close the lid and wait until you see 2 dashes appear. Once you see the 2 dashes, press OK. Once you get your reading, you are looking for a number either above or below 1500. If the number is above 1500, you will know the patient has an infection and the CTX4 treatment rinse will likely be part of your conversation, and if below, it will not. So a few things to think about in regard to the test price. First, do you want to charge separately for the test or include it in your exam fee? Next, who will be performing the test? And this may be multiple people depending on which patients are being offered the test. For example, the assistant or doctor might do the test with new patients, but hygienists will likely do it for recall patients. We have provided some sample scripting to help you through the entire process. I recommend you take a read through this and do some role playing. So moving into the next few weeks, you'll want to decide on a launch date, a day that you will begin working with patients and put your protocol to work. You should pick a date no more than 2 weeks out. The last part of the protocol, reassessments, will be covered in the next training, scheduled for approximately 6 weeks out. The next training won't be so content heavy. We will be evaluating your program, answering your questions, and making modifications to the program if necessary. So I would like you to keep a log of questions as you're implementing the program. Bring them with you. We've provided you with a question log in your booklet. This will be the platform for our next discussion. Make sure you bring your booklets with you next time. And as a bit of homework, please read pages 66 through 76 in the Balance book before the next training. It will give you a better idea of how to set up the reassessment appointments and what to expect. If you need to schedule your next training, please be sure to get that on the schedule by calling 866-928-4445. Thank you for your time and have a great day.